From the PEP Radio Newsroom, this is the News Blast for this hour. For our listeners north of the border, happy Canada Day. LGBTQ Nation is reporting that where the National Democratic Party stands on trans issues right now was most clearly illustrated at a recent budget committee meeting for the GOP's so-called One Big Beautiful Bill, also known as the Big Ugly Beautiful Bill Act, or BUBBA, ahead of a July 4th passage deadline dictated by President Donald Trump. During a committee markup in May, House Democrats did not contest a provision in the Republicans' reconciliation bill that bans Medicaid funds from being used for gender-affirming care for trans people of all ages. Democrats didn't offer an amendment to get rid of it. Representative Dan Crenshaw, Republican from Texas, who led the ban effort, told NOTUS they offered an amendment for practically every provision, so this was telling, I think, deep down, they know they've lost the issue. That provision marked the first time a federal restriction on gender-affirming care for adults has passed a full chamber of Congress, months after Republicans pounded Democrats and their standard bearer, Kamala Harris, during the 2024 presidential election over trans rights. Democrats have retrenched and are just looking to cope with Republican dominance on the issue. They're also confronting a self-reinforcing cycle of unfavorable news on trans rights, driving poll numbers and support ever downward. Support for trans student athletes participating in school sports has dropped since states started passing legislation to bar their participation, and the more the president talks about the issue, the more negative the polling becomes. About 52% of Americans now approve of how the administration is handling transgender issues, according to a May poll by the Associated Press and the NORC Center for Public Affairs Research. At the same time, fewer people support trans people in the military, bans on outing trans and non-binary students to their parents, and gender-affirming care. The same poll found that most adults oppose public health insurance programs like Medicare or Medicaid, or for that matter, CHIP, from covering gender-affirming medical treatment. The Supreme Court's recent decision in U.S. v. Scrimeti that upheld a Tennessee ban on gender-affirming care for minors would have once occasioned Democrats to rally around a civil rights cause at the heart of their agenda, as they did with the High Court's decision to overturn Roe v. Wade. But rather than galvanizing opposition to gender-affirming care bans around the country, the decision has largely been met by Democrats with qualified opposition or silence. Representative Julie Johnson, the Democrat from Texas, a co-chair of the Congressional Equality Caucus, said she believes healthcare should be at the right and the role of the parent, and the court should have had a different decision. But she added, the Supreme Court has ruled we're either a party that supports the rule of law or not. By ruling that gender-affirming care for minors is a states' rights issue, the U.S. will have a patchwork of rules around it. That's the reality, Johnson says, we have to live with. Trans Representative Sarah McBride, the Democrat from Delaware, the first openly transgender member of Congress, said recently that Democrats have to negotiate with the drop in public support for transgender people. We shouldn't treat the public like they're Republican politicians, she told the New York Times. The best thing for trans people in this moment is for all of us to wake up to the fact that we have to grapple with the world as it is, that we have to grapple with where public opinion is right now, and that we need all of the allies that we can get, McBride said, explaining that Democrats need to create room for disagreement. Why? Why, Representative McBride? You, of all people, should be standing in full support of the trans community, and yet you're standing more like on the sidelines. Like the Supreme Court's ruling in Scrimeti, there's a patchwork of responses to trans issues among Democrats who are carefully reading their constituencies as they calibrate their positions. Nationally, though, they're at a loss, as seen in the by House Minority Whip Catherine Clark, Democrat from Massachusetts, contortions to arrive at a position on the issue. We are listening very closely to what the American people are telling us, and they're telling us they're in an affordability crisis. And we never help people afford housing or healthcare or childcare by taking away rights from a very, very small group of people. Republicans continue to push this issue as one to divide us, she said. Charlotte Clymer, a trans activist and Democratic strategist, was much clearer. We've been largely abandoned by the Democratic Party, she said. Looking at the past 6 months or so, it's become pretty clear that most federal Democratic lawmakers have no clear or obvious intention in standing beside trans people in this critical moment. That's the news story at this hour. As an aside, we don't like the news any more than you do. If this story prompted you to take action, contact your state and national representatives and senators. In the meantime, Pennsylvania Equality Project is conducting its Discrimination Survey 2025. Details are available at paequality.com. Up next, we have the Meadville area weather forecast here on PEP Radio.